Asthma? Question mark. Do cats have it? My 4-year-old male cat appears to have respiratory events 3 to 4 times a week. Looks like he's coughing up a hairball, but nothing comes up. When should I be concerned? Great question. Well, I would say that it's never a time to panic, but it is not normal for cats to cough like that. And a cat that is coughing like that definitely has something going on somewhere in the respiratory system that needs to be addressed. So asthma can definitely cause respiratory difficulty in cats. It doesn't tend to cause coughing quite so much. It tends to be more that they're just having difficulty breathing and they look very pale or their gums look blue, but it can cause coughing as well. There are also several different types of infectious diseases that can potentiate bronchitis and asthma in cats, or pneumonia. Cats can get pneumonia as well. Even worms can cause these kind of symptoms in cats. So intestinal worms, such as whipworms or roundworms or hookworms, sometimes they can migrate right into the lungs and cause problems there. Another cause of coughing in cats that should definitely not be ignored ever is heartworm disease. We tend to not think about heartworms in cats because they don't tend to have it as much as in dogs, and we just haven't talked about it very much. But we really should, because a big dog could have heartworms, could have like 2 or 3 heartworms and still act fairly normal. Where a cat, where their heart is much smaller, even one worm can cause significant issues. So making sure that it's not an infectious disease. I would recommend, if this was my patient, I would do an examination and then I would take some x-rays and I would see, what are we dealing with? Are we dealing with asthma? Are we dealing with bronchitis? Are we dealing with worms? Are we dealing with pneumonia? What are we dealing with? And then after that, once I have a diagnosis, then I would start to treat them. Feline asthma, it really ranges in severity, just like in humans. Some people can have very mild asthma, where what you see more in cats, more than coughing, what you hear is wheezing, right? And sometimes they'll just sit here on their little legs and just, and it'll be hard for them to breathe, and you'll hear wheezing. So feline asthma can be caused by many different things, many different allergens. And in cats, oftentimes we will prescribe steroids to reduce the inflammation. We can do oral steroids. We can do injectable steroids. You can actually do inhaled steroids now, just like they do for asthma in humans. So there are options out there. If your cat is coughing like this on a fairly frequent basis, even 3 times a week, it's still worth an x-ray. So I would get an x-ray if that was my cat.